If you're watching the impeachment hearings closely earlier this week, and probably not many people were, you were awarded with some pretty amazing footage that most people missed. It came courtesy of a congressman from the tiny but robust state of Rhode Island called David Cicilline, a former mob lawyer. We want to warn you, if you take CDC guidelines seriously, or if you're just a clean person, this will turn your stomach.
Let us be very clear. What took place on January 6, 2021 was an act of domestic terrorism by right-wing, sycophantic white supremacists.
White supremacists, that may have pulled your attention away, but look at David Cicilline. He sneezed all over his hands. Ugh. Remember, this guy is a member in good standing of the Party of Science. So he knows what he's doing because he's a scientist. In fact, David Cicilline understands science way better than anyone else in Congress. In fact, last year, he put on a clinic on proper mask usage. Watch.
Mr. Bezos founded Amazon in Excuse me, I'm going to remind members of this committee, unless you are speaking, our rules require you to wear a mask according to the attending physician. No, I'm speaking about another member of this committee.
Yeah, I will remind you. As he wipes his sneeze in his hair. Dr. Marc Siegel does not do anything like that. He's a Fox News medical contributor, author of the book, COVID, The Politics of Fear. He joins us tonight. Dr. Siegel, thanks so much for coming on. What do you make of this sneeze?
Unbelievable. It's hypocrisy you just saw there, first of all. And when you say one thing and you do another, that's the politics of fear, and then nobody wants to follow you as a leader. That's the first thing. Secondly, Tucker, I believe masks have usage if they're used properly with distancing and if you were actually to wear them properly the way physicians do. But the fact of the matter is that Congressman Cicilline has to learn something from me tonight. Let me tell you about a sneeze. We're always talking about asymptomatic spread, but this, like other respiratory viruses, Congressman, it spreads by sneezes. Did you know, Congressman, that sneezes travel 30 to 100 feet per second? Did you know that a sneeze has been studied and can actually transmit a virus not 3 feet, not 6 feet, but over 20 feet, Congressman, over 20 feet. And you know what? I'm going to give you some medical advice tonight, Congressman. You're not my patient, but you're a fellow Brown graduate like me. Here's my advice to you. If you sneeze, watch this, Tucker. If you sneeze into your mask, this is a surgical mask, I'm wearing it properly. Achoo! If you sneeze, you leave the mask on while you're sneezing. You don't take it off and sneeze onto the side. You leave the mask on. And now, Congressman, may I call you David? David, you're going to say to me, but the mask is wet, Doc. What do I do? The mask is wet from the sneeze. Here's what you do, Congressman. You take the mask off then for a second. You don't yell at Jim Jordan. You take the mask off for a second. You have a spare mask ready. Look, I got a spare. And you take your spare. You take your spare, and you put your spare on. You get rid of the old mask, and then you wash your hands, and you're done. You wash your hands. Tucker?
So you're approaching this as a physician with the mind of a clinician, but what if the point of the mask was to train you to wear a uniform and to give David Cicilline unwarranted moral authority? Think about that, Dr. Siegel. Great to see you. Thanks so much for coming on.
That's the problem.
Yeah, this is a problem.